Welcome, Wes here, pain relief expert, and in today's video you're going to learn about the causes of sciatica, how to diagnose for sciatica, and how to relieve your sciatic pain like a boss. And remember that you can always refer to your favorite clips in the description below. So sciatica is nerve pain that is usually felt in the buttocks at first, and the pain can radiate all the way down to the foot. It can make simple things like sitting and standing difficult. And when I had sciatica years ago, I couldn't even tie my shoes. And tripping over shoelaces is not fun. So what I've learned from my personal experience and through working with clients is that in order to diagnose sciatica, you have to know how and where your nerve is entrapped. Sciatic nerve entrapments happen because muscles and bones and nerves are really close together. It's like being on a crowded elevator. You can't possibly fit another person in. So you're on the elevator and you notice the elevator stops and you're with a crowd of people. Well, not only are you trapped in the elevator, everyone else is too. And that's how sciatica is. You have this one little entrapment site, and that affects the whole nerve down the leg and all the branches too. So let's say you're still trapped in the elevator and you have someone next to you with terrible body odor, or they fart, and it just makes the experience worse. This is the inflammation that happens when your sciatic nerve becomes entrapped. The inflammation is released and it worsens the symptoms. But the good news is we're gonna get that elevator moving again so we can release that entrapment and get you feeling good. Which brings me to the first possible entrapment site, the piriformis. The piriformis is like the diva of the butt muscles. Sometimes it just decides to cause a bunch of drama and squeeze the sciatic nerve. Let's see if the piriformis is the culprit with this assessment. The test you can do is on your side. You're going to bend your knee at a right angle, adduct it, basically bring it in, internally rotate it, okay? And if this causes you symptoms, there's a good chance there's something going on with the piriformis. Another easy test you can do is by comparing the affected side with a non-affected side with this stretch. So we're going to cross our legs and bring the knee down like this. This is a piriformis stretch. So let's say you have sciatica on your right side and you can only get your knee down to about here. But you stretch on your left side and you can get it down a lot more. This tells you that your right piriformis is tight and the nerve could be entrapped, and you definitely need to stretch that side out. Another common cause of sciatica is a bulging disc. So you have these gel-like discs in between your vertebrae. It's kind of like a jelly donut, but the jelly donut goes rogue and smushes, and the jelly goes out and into your sciatic nerve, causing the pain. The common disc bulges are L4, L5, and S1. A good test to see if you have a herniated disc is a slump test. So all you're going to do is slump as much as you can, and on your affected side, you're going to extend it. If you have a herniated disc, this will bring up your symptoms. Another simple thing you can do to see if you have a bulging disc is by putting your hands behind your back like this and doing a back bend. If you feel like that provides you with relief, there's a good chance you've got a bulging disc. Another cause is spinal stenosis. This is when the spinal canal narrows. The way you know whether you have spinal stenosis is if you naturally like to slump, because that puts more space in the spinal canal. So if you're walking around slumped and that provides you with relief, there's a good chance you have spinal stenosis. And individuals with spinal stenosis do not like bending the back backwards. That causes more symptoms. Furthermore, another culprit to sciatica is degenerative disc disease. So this is when, remember, the gel-like invertebral discs, they just hang it up and they say, we're not gonna support your spine anymore. So they collapse, and then that causes the sciatica symptoms. So there's no test that you can do for this, but what you can do is get an MRI or CT scan to see what's going on. Another way you can tell whether you have this is if your sciatica is accompanied by a dull ache. And arthritis in the spine is the same way. You'll usually feel that dull ache around your spine. And the next sciatica cause is a fancy word called Spondylolisthesis, which I just can't say it. So your spine suddenly decides to play leapfrog, and the vertebrae slips forward, making it an L. The way you test for this is simply by feeling your spine. And while you feel your spine, if you feel your spine cave in a little bit, that's spondylolisthesis. And the next cause I feel like is not talked about enough is a growth or a cyst on your spine. I had this client, we had no idea, doctors had no idea why he had sciatica, and it turned out that there was actually a cyst on his spine, and when he got that removed, it was gone. So if you feel your spine and you feel any lumps, could be a cyst causing your sciatica. So the next thing we've got is spinal misalignment. So this is going to be like your scoliosis. And sometimes scoliosis is only by like 5 degrees. It's really hard to see, but you can get some imaging such as a CT scan or MRI to see if you have scoliosis and see if that is the cause of your sciatica. Another environmental factor that causes sciatica that we can all relate to is sitting. Couches now are built for slump, and this causes muscle imbalances, more pressure on the spine, and it causes your blood to sit still and not circulate like it should. On top of that, if you're slumping and eating a jelly donut at the same time, then you start gaining weight around your midsection, which is bad for your back because you gotta support all that gained midsection weight. Another contributor to sciatica is stress and depression. One day, years ago, I was sitting on the couch like this, eating something, and I was depressed because my favorite Netflix series ended. And then to make it even worse, my back started hurting. But what I realized later is that I needed to either find a new Netflix series show, or better yet, go outside and take a walk. Another cause is sleeping. You gotta make sure you've got a supportive mattress and a chiropractic pillow or a thin one. And by the way, this is my dog. It's literally the easiest dog to take care of. So comment below about what you believe is causing your sciatica, and we're going to go over some treatments. In regards to treatment, it is a good idea to go to your doctor and get an MRI or CT scan because you can see more of what's going on. You can take pain pills, get shots and surgeries, and your doctor can lead you if you do decide to go down that route. But in my opinion, the natural approach is always the best to start with. And this is healthy living, this is stretches, this is exercises. I've seen so many people that were so close to getting a surgery, and they started doing stretches and exercises that I gave them, and they started feeling better. And that brings me to going over your natural treatment plan. What I'm going to show you is how to decompress the spine, and this can be applied to all sciatica conditions. So you're going to find a chair with some armrests, and you're going to pretend like you're pushing yourself out of the chair, okay? And then you'll stop midway, and then you're going to lean back. All the weight is going onto your arms and your upper body, and then you're going to let your hips and your butt hang. Just let all those muscles in your hips go soft. And what you should feel is a pulling force. Another thing you can do is grab on top of something like a door and just let your body hang from here. You can also move your hips from side to side. For this next one, you're definitely going to want to find something sturdy to hold on to. So you'll hold on to something, you'll be a couple of feet back, and from here you're shifting the hips back, okay, and just relaxing back here. If you have spinal stenosis, this is gonna feel good with that back curve like that to create space in the spinal canal. If you have a bulging disc, you want to straighten out your back when you do this. And you'll definitely feel the stretch more in the hamstrings when you do that. So if you have a bulging disc, the McKenzie method will be best for you. So you're going to put your hands behind your back like this, and pinching your shoulders back, you're going to bend your back, opening up the chest, your hips come forward, okay, and that's going to relieve that bulging disc. And if you have spinal stenosis, this will be good for you. You're taking your left arm up, going diagonally, getting a good stretch in the left side of the back, and then switching sides. That will really work to create more space in the spinal canal. And of course, if you have Piriformis Syndrome, the best stretch for you would be crossing the right leg over the left, pushing the knee down lightly, and getting to 90 degrees. Or however deep you're comfortable going. If you're only comfortable here, that's perfectly fine. So if you have some other things going on like degenerative disc or arthritis or scoliosis, etc., it's always important with all these conditions to make sure that your supportive muscles are strengthened up, because muscle strength will support your spine. And one thing that's really effective that you can do anywhere is bracing. So squeezing your abs and squeezing your glutes. I'm doing it right now. Ab squeeze, glute squeeze. Bring the belly button into the spine, squeeze the butt cheeks together. You can do reps of this during the day, and you also want to do this when you're picking up stuff. You're picking up a box, you want to go abs, glutes engaged, pick up the box. If you're walking, you want to make sure you're drawn in and that your glutes are engaged, because this all provides support for your spine. Without your muscles, you'd just be a big bag of bones. Another thing that we can do to make sure our spine is in line is simply by looking in the mirror, okay? Look at your back. Is your butt pooching out, okay? If your butt's pooching out, that means you have something called an anterior pelvic tilt. And the butt pooch, it compresses the nerves in the back, so you don't want that. So if you feel like you have a little bit of that, then you want to do these posterior pelvic tilts to make sure your pelvis and your spine are stabilized. So the way you do this is you're crunching, squeezing the glutes, and tilting the bottom of the pelvis forward like this. Another important thing to do to relieve sciatica is to make sure that you have ideal flexibility in your legs. This is your quads and your hamstrings. You see, sometimes your muscles like to play tug-of-war. They like to pull your pelvis forward, or they like to pull your pelvis back. So you gotta stretch. So if you tend to kind of walk like this, you know your hamstrings are tight. You're being pulled back, okay? And if you walk like this with your butt out, then you know your quadriceps are tight, because that's pulling down on your pelvis. So we're going to go through a couple of hamstring and quadricep stretches. We'll start with the quads. So the way that you know if you have good quad flexibility is through a test of keeping your abdominals tight, keeping your pelvis tight. You don't want your pelvis to go like this, okay? Keep your pelvis in line, and then you'll take your knee behind your other leg, okay? So you're taking the knee right behind, and if you can touch your heel to your hip, then you've got great quad flexibility. But most of us have really tight quads from bending over and from sitting. So this stretch will be a really good one to start with. All you do is find a couch or a chair, and you're putting your foot on it like this, and from here you're going into that posterior pelvic tilt. So you should be able to feel a heavy or a light stretch in the quad depending on how flexible you are. And that's a good start. You can also do this same thing laying down, a quad stretch. So you lay down on a couch or a bed, and you grab the leg. Make sure your abs are tight and that glute is tight. And you can also stretch it out that way too. Another way you can do it is simply by standing. Okay, standing and then grabbing the leg and pulling it to the glute. And the really important thing that a lot of people miss on this is keeping that pelvis forward and not like this. You don't want your butt to be out, because with my butt out, I can get my leg really far to my hip, right? But that's not going to be a true sign of my flexibility. So let's talk about stretching out the hamstrings. So the hamstrings can pull the pelvis like this, making an awkward curvature in the spine that can cause sciatica. So we want to do a test to make sure we've got flexible hamstrings. The way we do this is straighten up the back, okay? You want your back to be straight, abs to be tight, and you're going to come down, and if you can get to a right angle or like 90 degrees, then you've got good hamstring flexibility. It's going to be the same way laying down. You can lay down, take up your leg, and if you can get it up to 90 degrees, then you've got good hamstring flexibility. And if you don't have ideal hamstring flexibility, you definitely want to start with some light stretching to stay away from the symptoms. So a good way to start is simply by standing and slowly sliding your hands down your thighs to your knees and below your knees if you're comfortable until you get a light stretch and see how that feels. If that doesn't feel really good, then another option is laying down on something like a couch or a bed and just bringing your leg up until you feel a light stretch. And you can hold it in the back too. Okay? Another way you can stretch the outside of the hamstring, given that this is feeling comfortable, is you can internally rotate the leg and foot like this and then bring the leg to the side. This gets the side of the hamstring, and a lot of times the nerve can be entrapped in this area too, in the hamstring. So it's a really good stretch that you can do. So we know that we need to strengthen up the supporting muscles around the pelvis and the spine to stay away from sciatica. So we're going to do a couple more exercises. So the first one is a crunch. You can do this on the couch like I'm doing. You can do it on the ground. You can do it on the bed. The way you're going to start is bringing your belly button in towards your spine, and you're going to crunch forward and squeeze those abs together, and you're sliding the hands down towards the heels and back up. The next thing you can do is a bridge, and a bridge with a pillow in between your thighs. So you're going to squeeze the pillows, getting the muscles called the adductors engaged, and we're going to bring the hips up and squeeze the glutes and the abs. So that we've got a lot of things going here. We've got those inner thighs that support your spine and pelvis. We've got your abs. We've got your glutes. It'll just go through some repetitions doing these bridges. Next thing we're going to do is a squat. We do squatting every day. It's so natural. So we're just going to start with a mini squat, and we're really going to work on form. So remember, abs, glutes engaged, and we're going to sit back into it with our arms forward. Okay, and you could just start with just getting about this depth. You can also have something supporting you like a chair or a countertop in front of you too if you need that. And you're just focus on squeezing the glutes as you come down and squeezing those abs. Also squeezing the quads too, because the more you can get those muscles engaged and strengthened up, the more support you'll have around that spine and pelvis, and as a result, your sciatica will get better. And of course, as you do these more, you can progress to going lower into the squat. As you go lower, the knees will start to track forward, and eventually you can do sit down and get ups off the couch if you feel comfortable. Another thing that's really good for a lot of sciatica conditions is stability, okay? If you don't have stability, you're going to get a lot of unnecessary stresses on the spine, and that's not going to help your spondylolisthesis or your arthritis or your degenerative disc, whatever it may be. So we're going to do a one-legged stability. You can start off with holding onto the wall if you feel kind of unstable at first. Okay, and as you feel more comfortable, you can just use fingertips just to bring yourself back to the middle. So note that you want to feel your glute fire when you come up, okay, because that hip supports this whole pelvis. It supports the spine too. It's a really big muscle, so you want to get that engaged. And you're just practicing on that one-legged stability. You can start with 5 or 10 seconds or however long you're comfortable with, and you can slowly progress yourself up. Another thing that's important when it comes to sciatica is posture modification. So if I'm sitting on the couch, working on the computer, reading, watching TV, I'm gonna make sure that I have support, right? I'm gonna make sure I have a lumbar support down here, or if you have a huge couch like this, you can put a pillow on your back, and that'll help support your back and relieve your sciatica. Another thing is, don't lay like this. Lay with your head flat. And also take a little time to do some deep breathing and some relaxing. Sometimes we hold stress and we don't even realize it. So we can release our stress by taking a breath through our nose and letting our stomach and diaphragm expand and breathing out slowly. You can also do a focused meditation, focusing on a part of your body. So for your pinky, for example, you can close your eyes, focus on your pinky. This helps draw your mind away from any daily stresses or anxieties you have. Another good thing for a sciatica to experiment with is heat and ice. Ice is good if you have a lot of inflammation. Heat is a good experiment, and sometimes it feels really good for people, but sometimes it will aggravate that inflammation. So it's just something that you have to experiment with. And definitely post a comment down below about your experience with sciatica or any other content or topics that you'd like to see in the future. And I know that we went through a lot of stuff, so definitely come back to the video and look at some of the clips. That way you can remember the assessments and some of the exercises and the stretches and the decompression, because it'll all help. And if you want a healthy back, which of course you do, subscribe to the channel because you can get some easy access to some great information. I sure do hope that you enjoyed this video and you found it helpful. Farewell, and I'll see you next time.